This is it, the Plasma Typhoon, a new solution to improve hygiene in endoscopy. Pentax Medical officially presented the device to enhance patient safety at the ESGE Days 2019 in Prague.
Plasma Typhoon, it's a medical device used for ultra-fast drying of endoscope channels and for active storage of the endoscope in the single-use recipient plasma bag. This innovation improves in a significant manner the hygiene of in endoscopy and allows to minimize the risk of contamination after the scope reprocessing.
Several cases of cross-contamination after an endoscopic procedure were reported in literature. Research from the Erasmus MC shows that in 22% of cases there is still bacteria from the previous patient on the device. The tubes of the endoscopes are made of plastic and are therefore not allowed to be heated, making sterilization impossible. The tubes can only be disinfected. Afterwards, they are commonly dried and stored in a drying cabinet. The Plasma Typhoon offers a new way to dry and store the scope with plasma, therefore reducing the risk of contamination.
Once in a while we do come across patients, especially colonoscopies, wherein we see that we find features which are secondary to infection, so that's a neglected area, exactly, yeah.
Well, Pentax Medical is involved since many years in the prevention of cross-contamination in endoscopy. We are definitely committed to improve the clinical outcome and also the healthcare productivity. And we understand what we have to do, and our engineer knows what we have also to provide to our site and customer. Based on our insight, we were able to introduce our new solution named the Plasma Typhoon.
Plasma Typhoon improves the hygiene of endoscopy because the system dries perfectly the channel of the endoscopes, and the single-use recipient plasma bag keep the scope in the closed environment, reducing the risk of bacterial contamination.
I think it's useful. It should be an easy way to store the scope with the certification.
The focus is usually on cleaning of endoscope, but if you do not dry properly at the end of the whole procedure, then you make all your work for nothing. Yeah? You have to dry the endoscope in order to avoid any recontamination, in order to avoid any regrowth of bacteria.
I think it's a very important topic and a very important thing for us as doctors and of course for nurses.
The Plasma Typhoon is the first solution to guarantee a dry endoscope within 5 minutes and storage for up to 31 days in a fully controlled environment. Biotech Gemond validated the Plasma Typhoon according to European standards.